Before March of 2016, the most stressful thing we'd ever gone through as a couple was Chris going to law school and having a baby at 32 weeks instead of, a full-term baby. And we thought that, those two things were really hard.
I had graduated law school and Abby's health had gotten much, much better. And I remember thinking around that time, okay, things are gonna start getting better now. I do remember thinking, oh, we made it. We got through this, we've made it. It didn't last very long.
It didn't last long at all.
The Austin community is coming together to rally behind two champions, the Andrews sisters.
Two beautiful girls, full of life, heart, and love. Belle is 6. She's proud of her job as a big sister. Abby is just 2. There's something about a mother's intuition. For years, Belle was in and out of doctor's offices.
I already had a sense that something was going on. I just didn't know what it was. I didn't know how it was all tying together.
There was no answer for the Andrews. Genetic testing was suggested. The process was long. The wait felt even longer. The heartbreaking news came back early in March of this year. The diagnosis, Niemann-Pick Type C1.
Niemann-Pick Type C1 is an inherited disease. It is a disease that fits in a larger category called lysosomal storage diseases. In this case, in Niemann-Pick C1, there's an inability to get cholesterol out of the lysosome, so the storage material is cholesterol. And when that cholesterol accumulates inside the cells, it causes damage to the cells and leads to cell death, particularly in neurons in the brain.
Soon after Belle was diagnosed, Dr. Gibson said, I think we need to test Abby right away. And they came back that Abby has the exact same genetic markers as Belle. So both girls have the exact same disease.
There's no cure for NPC, but there is so much hope and promise in the form of a clinical trial. However, the Andrews quickly found out that living here in Austin was going to make getting that treatment very difficult. You see, there are only 2 cities in this country that have been approved as clinical trial hubs. So for 10 months, every other week, the Andrews flew all the way to Chicago, where the girls would undergo anesthesia and get an injection into their spinal fluid.
When school was over, we all headed to Chicago, and that's sort of how we spent that summer, was going back and forth to Chicago every 2 weeks.
One of the first really big amazing things I noticed about them is no moss grows on them, shall we say. Immediately, they decided that they needed to have an arm of the clinical trial in Austin, Texas. Literally within 3 months, they had gotten the approval for an arm of the clinical trial to be done at Dell Children's Hospital.
Children's Medical Center in Austin has changed the medical landscape for children who face some of life's most difficult challenges.
Dell never said no. They said yes immediately. It really is a credit to this institution how quickly they came to our aid and to all these kids' aid.
The Andrews and 2 other families, their treatment with Dr. Park is now only about a 20-minute drive away.
I'm hoping that this medicine will really stabilize, and I think in Abby it could prevent any progression. That's the hope. And with Belle, it could stabilize her and she could be in school all the way through high school.
This is a situation where we might be changing the disease. Okay. All right, smile. And for a child neurologist that has had to do that kind of talking with families all these years, this is very exciting.
As the Andrews continue their journey, they start their own efforts in the Firefly Fund with the goal of finding a cure.
The mission of the Firefly Fund is to fund and support the acceleration of a cure for rare neurodegenerative genetic diseases that affect children and currently have no cure.
Pam and Chris and the Firefly Fund are, of course, exemplary. This is community, yes, as Dan mentioned, but it's also what we call citizen science. When citizens identify a problem, a question, a need, and catalyze solutions in concert with professional scientists, clinicians, and engineers. So what Pam and Chris and the Firefly Fund are accomplishing will be in the textbooks of the future.
Today marks World Rare Disease Day. It also marks 1 year since the Firefly Fund was officially established. And the Andrews would like to see NPC1 added to the federal list of recommended screenings for newborns. They encourage people to join the fight and help shed a light on this disease.
Firefly has 3 programs that we are funding at the moment. We fund medical research for children affected by neurodegenerative rare diseases. We also fund patient access funds, and we are focused on newborn screening.
Newborn screening, I think, has a very important role because it will allow us to be able to identify the patients early. And by identifying the patients early, we can intervene early. And what we know is that if we can intervene early in the NPC patients, that we have the greatest chance at being able to delay the disease progression.
Foundations like Firefly and other patient or family-driven foundations are actually really important because they help keep the momentum going, they provide the sense of urgency, and very importantly, they provide funding. So sometimes we have ideas for projects, or it might be really early, and if we can get some promising data, then we can help fund the project through government grants. So the family foundations are often able to provide some of that initial funding, which helps us generate the data and then get the bigger grant to move on to, the therapy.
The folks affected by this disease are not confined to Austin or Texas. They're found all over the world, and their families and doctors and scientists everywhere affected by researching and fighting to find a cure for NPC1. These families, doctors, and scientists will be positively impacted by what you have done here tonight and by the continuing work of the Firefly Fund.
It became clear that it was going to become our life's work.
It only takes a handful, or 2, or 1 person to change the world. But there has to be that person. And they are this.
One day, we'll get to the day where no family, no child, no mother and father will ever have to experience what we've had to experience.
We wouldn't have been able to create the Firefly Fund had it not been for our friends and our community and our village of supporters in Austin that came to our aid and literally put their lives on hold to help save ours. And had it not been for the Austin community coming together for us, the Firefly Fund wouldn't exist.
The way that we approach any of this is with certainty. We're not hoping for anything. We're approaching it with certainty, as in we will cure this disease and any other outcome is unacceptable.
There's a huge need out there, and Firefly has a huge job ahead of us, but we're up for the task.